So we're live. Thank you guys so much for taking some time out to do this with me today. I know it's been a few months though since we did onboard and do the diagnostic on your device. So we'll start off with just a brief introduction about, yourself, your names, name of your practice, and how long you guys have been practicing for.
Sure. So my name is Dr. Katina Jimenez, and I am at Champion Chiropractic of Pasadena. We've been open in this location for 3 years now, I believe. And before it was part of a separate practice that I sold off that practice. So this kind of got splint off from that practice and became its own thing. And yeah, been slowly growing it. And StemWave has done a really great job of helping us grow. So yeah, I don't know what else to add to that.
Awesome.
And helping people get better.
Yes, of course.
A lot better.
Yeah.
I'd love to hear that. Awesome. Mona, did you want to also introduce yourself?
I'm Mona. I do the StemWave. I do the physical therapy. My favorite part is once you do the StemWave, that look on their face, it's
The disbelief.
exactly.
Yeah.
Like, wait a minute, wasn't I just hurting? Yeah.
Transformative. That's
Yeah.
awesome.
That's a good one.
The million-dollar question, and this is what everyone wonders, is what was that aha moment for you guys that prompted you and made you guys realize that integrating StemWave just made sense for your patient base?
So I've worked with a bunch of different modalities in other offices. Ultrasound was always our kind of go-to when it ever came to localized injuries, and I never really saw a very good response from that. It didn't make sense to me that we were heating up tissue rather than trying to help it heal. When I started looking into StemWave, I looked into a number of different companies. I won't name their names. But StemWave very quickly came to the top of that list, and that's based on obviously the machine and the quality of the machine and what we're actually doing. And I realized that a component of chiropractic care that was being, I don't want to call it neglected, but just not properly addressed, was the localized pain issues, especially outside the spine. So arthritic shoulders or arthritic knees. We can do what we can with chiropractic to balance out the spine to make sure that we have full function of our nervous system. But it wasn't a direct answer to a patient's main complaint, like a left knee or a right knee or ankles and things like that. So when I was looking at the other modalities and I was realizing that our tool belt was kind of lacking and that StemWave really comes in and fills that hole, it makes care for our patients be more complete. So if I have somebody coming in with a left knee problem, for an example, then I address that left knee problem with structural chiropractic. So we rebalance everything, make sure everything's working correctly. And then we go and do StemWave. And then it's a hard moment to tell them, hey, calm down. I know you can jump up and down and run if you want to. However, one of the things I say is that the paint's not dry.
Paint's not dry.
Yeah, I'm just calm down. The paint's not dry. And, there's a lot of disbelief that they're like, I just can't believe that this feels so much better. And it sounds like we're car salesmen when we're talking about it. And it feels kind of like phony, except that now that we've been practicing with it for a good 3-4 months, I think 4 months since October. No, that's not a year. February.
Yeah.
Thank you, Janny. Yeah. So since February,
Yeah.
and we're actually seeing it in real time, and we're seeing the patients that are coming in and seeing their results, then it's much easier for us to express that to our patients without sounding salesman-y than we did in the past,
And we're also able to see our very first patients come back and say, no, it still feels good. I mean, maybe just a little bit there. And we have her come once a month.
Yeah, she's
once a month. And she's just like, oh, you knocked it out. We're good. So, I mean, we see the results. Yeah.
And it just completes chiropractic care. I mean, our job is to help the body heal on its own, right? And we're just asking it to, and it makes sense with chiropractic.
That's so interesting that you mentioned, the term complete care. I'm really curious, can you maybe elaborate on what some of your expectations were clinically going into this versus what were the like some of the outcomes that you guys have produced, like integrating this over the last few months?
Well, we get really silly excited when somebody says they have arthritic knees. And then we haven't worked a whole lot with too many shoulders. We've worked with a couple of shoulders. But just here recently, we worked with a martial artist who had an AC arthritic issue, and he was going to go compete that same day. And we did StemWave on him, and he was able to get his hand above his head, which obviously you need to do when you're a martial artist. And he went out and competed that same day. And I mean, I forgot your question. I'm just rambling.
All good. It's,
I'm just excited. It's just, that's the truth of it.
I love that. That's awesome. Did you want to add to that, Mona?
No,
She's
because
like,
I
no,
forgot
she
the
just
question.
rambled.
Because I get so engrossed in your stories.
Yeah,
I'm
I
like,
know, me
yes, I
too.
know.
Yeah.
No, I
No,
think
so
it's super
think-
fulfilling. Yeah, go ahead.
I think your question was like, what conditions do we like know that the StemWave will help best with? And yeah, it's arthritic knees, hands down, are one of our favorites. Shoulders are our favorites, and some feet issues. We sometimes have to rule out inflammatory arthritis in feet. So sometimes, they won't be 100% clear that StemWave doesn't help really well with inflammatory conditions.
Oh, we got a third guest.
Yes, we have Jenny with us too. She's our receptionist. She's
Awesome.
she's handling the background stuff right now.
I love that. It's so interesting that, thank you so much though for mentioning some of those conditions. I'm also wondering, let's say if someone does come in with a shoulder injury or knee pain, what is like your typical process for going about recommending StemWave as a treatment option to them?
You first.
It comes after the exam that we do in the office for any patient that walks through the door. So they go to me, and then I do a full exam, and obviously I'm examining the knee for any injuries, doing orthopedic testing, doing functional movement screens. And if it becomes obvious to me that there would be a good StemWave candidate, then we do StemWave that same day.
Okay.
Mm-hmm.
And I know every clinician's methodology and school of thought is going to be different. And it's pretty common in the same practice as well, right? Because I know you're here with us as well, Mona. Did you have anything to add to that? Do you have any specific intake process or any specific approach when it comes to recommending StemWave as a treatment when you're working with patients?
I usually tell them, when you have one knee, you'll have another knee because you've been overcompensating for the bad knee. And they're like, oh, I never thought of that. So, I mean, that would, when you got one, you got the other one. So that's basically it. But yeah, normally when they come out of her, she knows, okay, that they need StemWave. They need the StemWave.
Yeah.
And then we do the StemWave. And then they come out and they're like, oh.
There's that aha moment then.
Yep.
With that being said, have you guys noticed possibly like an increase in patient retention or word of mouth referrals come your way just as a result of like offering StemWave therapy as an option?
Yes, and it's brought older patients back out of the woods, and they've come back into the office seeking the StemWave therapy. So yeah, the answer is yes. And it makes word of mouth recommendations much easier because of that aha moment. Chiropractic care can sometimes be a slow moving process where you don't really see a whole lot of results until maybe your third or fourth or fifth visit when things actually start, actually moving correctly. But with StemWave, because the results are like within 5 minutes, it's much easier for us to get them to, tell their friends or tell their neighbors or cousins or their tia or, their arthritic grandma or whoever, they feel like could benefit from it. So yeah, word of mouth referrals are really easy to get on those patients.
Yeah, no, that's huge. Some of the sometimes we get a lot of people coming into our process who are sometimes on the fence And the reason is they're not sure about how they can market this and integrate this as a modality within their practice, especially if they are like a solo practitioner or they do have a smaller team to work with. And I do know from, my understanding and when we did first speak that you started off with like you have a very small team and you started off as a solo practitioner.
Yes.
And you've come such a long way with, a lot of the clinical success, but also, for your business as well, you saw that success. So, I think a lot of people would love to hear like some of the ways that you've marketed and introduced this technology to some of your patients who may not know what shockwave is, let alone the term StemWave, or but they were familiar with a lot of the more traditional routes of chiropractic care.
Yeah, so we have an event that's scheduled for this Saturday that is a StemWave demonstration. We had a ribbon cutting with our local Chamber of Commerce that was surprisingly very productive. I wasn't really expecting it to be. I had kind of low hopes for it. I've been parts of other chambers before, but because StemWave came out in my office right around the same time that we did the ribbon cutting with the Chamber of Commerce, we had people who wouldn't normally do chiropractic at all come into the office. And because those people are business people, they, went back to their businesses and then told everyone in their business how well they were doing with StemWave. And so it became its own self-feeding mechanism. So that network we kind of accidentally fell on. We didn't really intend it to go that way, but it really did. We did a demonstration during the ribbon cutting. A couple of people tried it and their eyes got huge, and we had people signing up as they were walking out the door. And these are, these are politicians and these are, other business owners. And so it was that by itself was a really unfortunate. It was an accident on my part, but it was a smart accident.
Yeah.
So yay. And then we've done Facebook campaigns. We're noticing that the environment of Facebook is slowly starting to change. I think people may be moving off of that social media platform. So we've kicked it up a little bit on Instagram, not much on LinkedIn, but those are other places that we'll be branching into relatively soon, because the Facebook campaigns just aren't doing as well as they had originally done. Let's see what else. MailChimp, we use MailChimp. So there's an email campaign called MailChimp that we use that uses our own patients and ones that have consented to receiving emails. And we put an introduction to StemWave on there, where it explains what StemWave is and the areas that it works best on and conditions that it works best on, and sent that out to our whole patient base. And patients that had, retired from their chiropractic care or had moved away, or I had somebody come in from Katy the other day. They went to Katy. Oh, well, that's true. So Houston's a really huge town. So Katy's about an hour and a half away, which is a pretty good drive. So so we had people coming in from, other parts of the city because they heard about it and they're seeking it out. I'm proud to be one of the first ones. I have a sneaking suspicion that StemWave is going to be everywhere in a very short period of time.
Agree.
So I want to make sure that I get a very strong foothold in my community, so that I become the StemWave person that they would prefer to go to, because I've been here the longest, right?
So we fix everybody else before everybody else gets their StemWave.
Yeah, we're racing now.
Yeah,
basically.
Yeah.
Yeah. And I guess, what that translates to is, for anyone who is, wondering, should I, get this machine, to start now, essentially, right? Because we have practices like yours who are already, moving with, incorporating this in their practice and, kind of getting ahead, right, before this does become, a little bit more widespread and common in multiple states. So that's awesome.
I suspect it's going to replace our electric stimulation units, just like we, as chiropractors have e-stim units. I think it's going to replace those, and it's going to become that common.
I
For
see.
sure.
It's going to be a standard of care. You're going to come in, you're going to have chiropractic, you're going to have StemWave. I'm surprised that the PI people aren't on that yet. I would expect for them to be on that pretty quickly. So I'm sure protocols will start involving StemWave therapy. Mhm.
Absolutely. With that being said, have you guys layered StemWave with any other modalities within your practice? I know you guys are multi-specialty a little bit, and you did mention physical therapy. And I'm curious to know, and we do get a lot of physical therapists who are inquiring about whether this is going to be a good fit for them. How have you guys incorporated physical therapy or perhaps maybe some other modalities with StemWave within your treatments?
So part of our treatment program can be just StemWave. You
Mhm.
just come in, you have StemWave, and you leave. There are probably maybe 5% of our practice members that do that. The majority of them do a combination approach. So we do chiropractic care and StemWave and physical therapy. Um, our physical therapy is not a long program. We don't do hours and hours of physical therapy. We do very focused and gentle physical therapy. So we're not, I wouldn't compare us to a physical therapist on that side, because we also do chiropractic care and we also do the StemWave. So it all works together as long as it's focused correctly. Um, but I mean, I'm gonna be I don't want to tell the physical therapist that StemWave's out there. Send
That's
them,
after we fix a bunch
yeah,
of people.
send them to the chiropractors who have StemWave first. But no, it would be beneficial for a physical therapist as well, because they're dealing with a lot of extremity issues, just like we do in a chiropractic office.
Yeah.
So arthritic knees and injuries and soft tissue injuries and ligament injuries and all of those highly benefit from StemWave therapy. So whatever they're treating, we're also treating, and StemWave just does an amazing job there.
That's great. No, I think that's still regardless like super informative for anyone who is wondering from like a PT perspective,
Yeah.
whether this will promise that clinical results. So could you describe like a recent patient case where shockwave with using StemWave where it's made a noticeable difference in pain reduction and just like functional improvement?
Pick your favorite.
Their
I mean,
favorite, multiple.
she has lots of favorites, but
I do.
she hates saying favorite because then she
I
thinks,
don't do favorite.
yeah, pick the most memorable one.
I mean, Yolanda, she cried.
I mean, she did.
You know.
She was hilarious. So we the very first day, so we unboxed the StemWave, and we had gone through some of the training online. We knew generally how to operate the machine. Not fantastic. We went to the training that was in Pittsburgh. We went to the training that was in Pittsburgh, and we learned a whole lot during that training, which really helped with our patient outcomes. However, the first day that we unboxed the machine and we were all excited and we we're ready to go, and I wasn't quite confident with it yet. We had a patient who came in and she just sat down. She came in, didn't say very much, just came in and sat down, and she said she had just got finished with her orthopedist or her yes, orthopedist.
You're right.
That she had just finished with her orthopedist, and her orthopedist had refused to give her any more injections in her knees until she schedules a full knee replacement. So she sat and cried. She's got family. She's the matriarch of her family. She's got her own kids. She's taking care of grandkids. She's trying to keep up with everything, and she just can't have a surgery because that means she'd be down and out for too long. So she sat and cried. She was really actually quite desperate. And I sat down with her and I, told her, we just unboxed this machine yesterday. It's brand new. I don't have a whole lot of confidence in my own techniques, but would you be willing to let me learn with you? And she was completely on board with it. She's like, yeah, let's just try anything. So there's that. So we went and we did StemWave on one of her knees. We just focused on the worst one of the two knees. And by the time we were finished, we did a little squat test before we took her into StemWave, and she could hardly have body weight squats that were more than 10 or 15 degrees. Then we took her in for the StemWave, and she begged us to do the second knee. So we did the second knee, and then I was with another patient by the time Mona had finished with the StemWave on the second knee. And she came and knocked on my door, and she starts bouncing in my door. Look at what I can do. And she's jumping up and down. And I'm like, no, stop. So she came and bounced up. She went home. She cleaned her house. I don't know what else she did, but she came back the next
She
day.
put heels on for the very first time in how many, 20 years?
Yeah.
In 20 years, she was able to put heels on.
And I was like, that's not what I asked you to do. I asked you to go
Correct.
home and take it easy. Don't ice, but just go and take it easy. And she went and did all the things. And she told me that the reason why she did that was because she didn't know how long it was going to last, because she's used to injections. She's not used to the body actually coming in and healing things. She's used to just having the injections that, temporarily offer some relief. So she became our very first patient. She signed up that same day, and she went through a full protocol. And now we see her once a month just for a touch up if she needs it. And she's doing fantastic. She's taken her kids or her grandkids over to the museum.
Walking the
Yeah.
whole time with them.
4 hours at a museum, going up and down all those stairs. And she said that she had the time of her life. So
She comes in these little wedges now, which
I
she
love
wasn't
that.
able to wear heels in over 20 years because the pain was so bad.
Wow.
Yeah.
that kills me as a chiropractor. However, as a lady,
As a lady.
Yeah.
Yeah, I mean, I could totally relate to that. I mean, that's huge. I mean, like, not just like from like a health perspective, but also, bringing life back to these patients, and allowing them to fulfill the opportunities that they, probably thought they would never get to do again. And I think that's so huge. And I'm assuming it gives you guys like that motivation as well to, continue what you're doing and just, go big with this. So
Absolutely.
that's awesome. Um, honestly, like outside of like your experience with the technology, like how has it been just like working with our team, like our staff, and just how has the support been here for you guys?
Oh, we've done really great. We kind of went off plan with the Facebook thing, just because I'm not technologically awesome. And so we went a little bit off plan at the very beginning. So it took us a little bit longer to get up and running. But if we had listened to the instructions that we were given when it came to that, we would have been in a different seat altogether. So lesson learned. You guys have a really good system that's set up, that's very user friendly, and just yeah, we overthought it from the very beginning. And as a doctor, we like to use our left brain more than our right brain, and sometimes we have to do both to get where we need to go. And social media is an important part of our world nowadays. So that was a missed opportunity from our perspective. So that's the only thing that I would. But that's not a ding to y'all. That's a ding to us, right?
And that's okay. I mean, I think we're a little bit different because there's so many different verticals that we've tapped into here at the company itself, but outside of just the product, there's so many different systems in place. So I wouldn't blame you guys at all. I think that there's just so much and it's so new that it's a learning moment for all of us, right? Trying to integrate everything at once. But we'll definitely I'll talk to the marketing team and see what we can do with that. See if they could reach out and we can get back on track. Now, what are some of your upcoming goals like for 2024 with StemWave, or even just like in the next few months if you guys have anything planned?
So we just recently split our schedule. So before, the schedule was all underneath me. So my schedule was, if any patient came in for any reason, it was underneath my schedule. So we recently had to split it in half because I see the patients the first time, and then Mona and I do the mapping together. So we work together, we get it done, we do the mapping. We have a computer EHR system called Jane that actually is fantastic for StemWave mapping, because you can actually like put the little dots in, and then you can put a key as to which dot means what. So we're able to get our maps done really quickly and easily. And after that first visit, when they've been mapped, then Mona has already been there for the StemWave mapping. So she knows what we're looking at. I've, talked her through, hey, I'm concerned about this patient, blah, blah, blah. And she's like, got you. So then she does all the subsequent StemWave therapies. And, I don't think you've had any problems with anybody, but if she does, she's like, hey, did you know this and this about this patient? And then we touch base with it. But we've had to recently split our schedules because now we're starting to overlap. And whereas, I can be seeing a chiropractic patient, she can also be seeing a StemWave patient at the same time. So now for a 10-minute chiropractic adjustment, she's also doing a 10-minute StemWave adjustment. And if you want to add the money together, then you're making that much more during an hour. So you can do 6 patients at 10 minutes per hour. And it more than doubles the income because StemWave is charged more, right, than usually just adjustment. Yeah.
With that being said, how has the incorporation of StemWave impacted the revenue for the clinic and just profitability from like a business perspective?
Oh, it almost doubled it immediately.
Wow.
Without adding staff, because I already had Mona as my physical therapist. So she was already doing physical therapy during that time. We have a receptionist and she organizes all of our schedules, but we added our StemWave and we almost doubled because of the StemWave.
Yeah, that's huge. And I think for a lot of people who are watching this video who are a solo practitioner or just kind of starting out their business, I think that's huge that you guys were able to crack that code. And the product itself, it like you didn't really have to go through a lot of hoops to do the marketing or go crazy with anything like complex in terms of like changing the way you guys operate within your business, and really with like a limited staff, smaller team, and really just being a smaller office, you guys were able to achieve that. And that's a huge thing. And I think for a lot of people it's going to give them that confidence to take that step.
Oh yeah, I'd do it again in a heartbeat.
Yeah, that's huge. That's so awesome.
Yeah.
I want to kind of like button things up since we have about like 1 or 2 minutes left. If you could give someone who may be like on the fence about purchasing StemWave like a piece of advice, what would you say to encourage them?
Get it. Just get it. Just get it.
Run away. Get it. Yeah, I'm slow to make decisions. I like to use my left brain. I like to analyze everything. I get stuck a little bit with analysis by paralysis or paralysis by analysis. It didn't take me very long to jump on this one. It just made too much sense. And it fits with chiropractic so beautifully because you're helping the body heal itself. Yeah. Rather than having to look on something outside the body or something that you have to purchase or buy or whatever to help your body heal. So it fits. It makes it so much easier as a chiropractor to have it in the office than not.
But we also did a bunch of research too, like on YouTube because I'm the researcher. Yeah. So I did like a bunch of research, read a bunch of stuff too. She'd send me, oh, it's over here too. So yeah, as soon as you started seeing the videos and you're like, that's not right. These videos are so altered, they're not altered. They're not altered. It is 100% real. It really is.
That is awesome. Well, thank you guys so much for, taking some time out to speak with me today and share your experience. I know it's only been a few months. I know you guys started in February, but I think it's huge, like the progress you guys have made with, the team that you guys have. And I definitely can see, I just sense it through our conversation, the impact you guys have made in the lives of your patients. And we're super happy to be a part of that journey myself personally, even though I'm not the doctor myself. But I think it's huge and it's huge for our team. So thank you guys so much. And I'm really looking forward to seeing the success in the next few months and for 2024.
Excellent. Okay. Thank you, Michelle. We appreciate you too.
No problem. We'll see you guys around.
Yes, ma'am.
Bye.
Thanks, guys. Bye.